Okay, so I'm going to perform a blood draw on Harlow in her cephalic vein. So I have everything ready for that. So I'm going to get that ready. So I have my butterfly and my hub, my 3 tubes. I'm going to do a coagulation panel on her, so I'm going to draw first into a blue top, my Band-Aid, and then some alcohol as well. Okay. And so Kayleen's occluding the vein for me. You're okay, babe. I know you like to talk. I'm going to hold the hub in this hand. Poker vein. So I got a flash. I'm going to draw into this blue top first until it stops flowing. Inverted a couple times. Draw into my purple top next. And as that's filling, I'm going to grab my Band-Aid. You're okay, babe. I know. And I'm going to draw into my serum. Oh, it's okay. We're almost done, baby. Okay, remove that. Put my Band-Aid on. Move my butterfly. Cap my needle. Put our Band-Aid on. And that's how you draw blood from a cephalic vein. Okay, so I am here going to perform a coagulation panel on my patient Harlow. So I already have her blood drawn in a blue top. I'm going to go ahead and insert her into our vet lab station. Okay, so that's my patient. Select my doctor, and then I'm going to use the Coag DX and then run. So I'm doing a PT on her today. So I have my clip, and I also have my syringe. So I'm going to go ahead and insert my cartridge. And it's going to warm up a little bit. Okay, now it's ready, so I'm going to take my syringe, gather my sample, and I'll put it in this little well. I want to do a couple drops so that it has a nice bubble on it, like that. And I'm going to go ahead and click start. It's going to go ahead and take my sample. Now it's running. So I'm going to throw this stuff away. I'm going to go ahead and remove the cartridge because it's done. Throw my cartridge away. My results are printing. Okay, so I have my results. It looks like she is in the normal range, so I'll go ahead and give these results to the doctor. Okay, so now I'm going to demonstrate how to make a slide for microscopic analysis. So I have my purple top. I'm going to go ahead and get my sample from that. get a really small dot sample on one side of this slide. I'm going to use this other slide to make a feathered edge. So that's what you want the feathered edge to look like. And then I'm going to set this up to dry. And I'll just leave it sitting here for a second as it's drying, and then I'll come back and do the stain. Okay, so now that my slide is dry, I'm going to go ahead and stain it using the Diff Quick stains 1 through 3. If I was doing multiple of these slides, I would make sure that they were labeled, but since I'm only doing one right now and I don't have anything else on my lab station, I didn't worry about labeling it. So I'm going to start in Diff Quick stain 1, and I do 12 full dips into the stain. 3, 4, 5, 6, 7, 8, 9. Okay, and then I'm going to go into Diff Quick stain 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and then Diff Quick stain 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, and then on this last one, I'll let the excess material kind of drain off a little bit. And then I will just set it here, lean it against this, and let that dry. Okay, so now that my slide is dry, I'm going to go ahead and take it off of this. Put it up here. I'm also going to grab some immersion oil because I'm going to be reading this on a high power. Go ahead and take off our microscope cover and turn it on. I like to start off the slide at 10. And so I will go ahead and focus the microscope on 10 first. Once that's focused, I will go to 40 and focus that. Okay. Then once it's focused on 40, I like to go between the 40 and 100 power. I will take a drop of my immersion oil and go ahead and put it on my slide. This is just so when the 100 slides across the slide, it's not going to cause any damage. And I'm going to go ahead and focus on that as well. Okay, and starting with reading a slide, I like to start off on the feathered edge if I'm looking for platelets, making sure that there's not significant platelet clumping in feline patients and patients that had a longer blood draw. Sometimes platelets can clump together and stick on the feathered edge, so I just want to make sure that there's not that, because that would account for why the rest of the slide would have had low platelets on it. So I start there, I scan that hole up and down, I do a couple passes of it. If I'm doing a manual platelet count, I will count 10 fields of platelets, and then I will average that and then multiply that by 15, and that would be my manual platelet count. Once I would get my manual platelet count done, I can also check the red blood cells, checking to make sure that there's no sort of parasite that's present, making sure that crenation can be common, any Heinz bodies, anything like that. So I check for that as well while I'm scanning up and down the slide. So I start at the feathered edge, I'll go down, go over a little bit up, just like that, all the way down to the other end. I'm also looking at leukocytes, so making sure I'm not seeing any reactive lymphocytes, anything like that. I'm having an adequate number of lymphocytes. If I see any basophils, anything like that, I will keep note of that while I'm looking as well, especially if I am doing a manual cell count, then I would keep track of all those as well. So yeah, that's how I read a slide on a microscope. Okay, so now I'm going to run a chemistry panel on our patient. So I'm going to go ahead and insert this patient's information into my vet lab station. This patient we haven't done blood work on, so I'm going to have to manually enter him in. Selecting my doctor, and then we're doing a CBC and a chemistry on him, so I'll select both of my machines and then run. We drew blood into 2 green tops, so we can run plasma on our catalyst to do the Chem 10. So I'm going to go ahead and put these in stat spin to spin them down. I'm going to make sure that this is on normal. Go ahead and set that. And that's going to go ahead and spin down. We'll wait for that, and then I can go ahead and do the catalyst. Okay, so my green microtainer tubes are done spinning the stat spin, so I'm going to go ahead and take them out. I just need one for this, so I'm going to go ahead and take this one, and then my 2 clips that I need. I'm going to head over here. So for this, I will need a sample cup. I will also need a pipette tip, and then I use this pipetter. So I will open this, put that down. And this is a 300 microliter pipetter, so it's going to get exactly what I need. I'm going to go ahead and put that in my sample cup. So take this off and then put that back in there. So I'll put the cap back on my green, and I put it back in there. Next, I'm going to go ahead and select my patient on my catalyst machine, select. And we're doing plasma. If I was running on a serum separator tube, I would click serum. And I'm going to do next. And this is going to go ahead and open. I'm going to take the sample cup from a previous run out. And put this sample cup in that. And then I'm going to go ahead and put my clips in there. So there is a little perforation right here, so I'm just going to use that to open it. And then put that in there. The light clips go on the bottom, so I'm doing a light 4 clip on the bottom. And then a Chem 10 clip, which goes on top. Go ahead and remove that. Once I got my clips all in, then I'll go ahead and click run. Okay, and then I will just wait. That's going to process and run the chemistries, and then when that's done, my results will print out, and then we can go over the results. Okay, so my chemistries are done running on the catalyst, and I'd already run my CC, so they're printing out. Okay, and so it looks like the blood work looks pretty normal, so I'm going to go ahead and give this to my doctor. I don't need to do any manual hematocrits or platelets on it. Okay, so now I'm going to demonstrate how to do an ELISA test. Today we're going to do a SNAP CPL test on one of our patients. So I'm going to go ahead and insert my patient information into our vet lab station. Okay, and then I'm going to prep my sample in a strip here. So I have my serum sample that I'm going to go ahead and run this on. So we took this out of the fridge. It has to sit outside of the fridge in room temperature for 20 minutes. So that's already done and it's ready. Oops. Yep. My bad. Okay, and so I'm going to fill this little microtainer container tube. I'm going to do 4 drops of the conjugate. And then I'm going to do 3 drops of my serum. Go ahead and invert this 5 times. And then I will go ahead and fill this little well that's in the CPO snap test. You can kind of see that my sample is getting sucked up into the snap test. Once I get that little bit of blue that's into this view window, then I'll go ahead and snap it. I'm just going to wait for that. Okay. And I'm going to come over here. Go ahead and click start timer on my test. It's going to, it has to incubate for 10 minutes, and then once it's done, it'll go ahead and alarm, and then I can insert my results. But when I'm doing a snap test, I always remember, so blue means 4, so I'm going to do 4 drops of the blue, and then red is 3, has 3 letters in it, so I'm going to do three drops of my sample. So, but yeah, and then once that's done, we'll go ahead and see what the results are. Okay, so my alarm is going off, so I'm going to go ahead and do my sample. I'm going to go over here and click my patient. So looking at my comparison, so my control dot is on there, which is good. I want to always make sure that my control is on there. If there's not a control dot on there, then this test may be not functioning correctly, so I would have to do it again. But it is there, and then there's a little, the second dot is also present, but it's not as dark or darker than the first dot. So I'm going to go ahead and click that it's normal. And then yeah, so my results are going to print out, and I'll go ahead and give those results to my doctor, and she'll go ahead and call the client. Okay, so now I'm going to set up my PCV tube so I can do a PCV reading and also a total protein. So I have these little plastic hematocrit tubes, so I'm going to go ahead and get 2 out. And I like to put them on the side of these because they're clear and sometimes you can lose them. And then I still have my blood in a 1 ml syringe, so I'm going to go ahead and take the cap off my needle. And then I like to just brace my hand against my bottom hand, put in a sample, and I like to leave about that much off the end. And then I put in the critical twice. And then I set it there. I'm going to do my next one. It's the temperature. Leave about that much again. Put in the crit seal twice. Set it there. Then I'm going to go ahead and cap my needle. You can see that they're about the same. I do want them to be about the same for the most accurate reading. I'm going to open up my capillary tube reader, put them in. I always want to make sure they're on opposite sides, balancing each other with the clay facing out. I'm going to go ahead and put this back down. Here's my stat spin. Open this up. I'm going to take this that was previously in there, put that in there, go ahead and shut it, and I'm going to set my setting down to microhematocrit. And that's going to go ahead and spin. Okay, so my microhematocrit tubes are done spinning in the stop spin, so I'm going to go ahead and take out this, unscrew it, and then I have a reader right here. So what I'm going to do is line up the top of my clay with the bottom 0 that's on there, and then I'm basically measuring the red color. So I would say that this would be 48% on this tube. And then I always measure the second one too. And that's about 46. So I always take the average of these two. So I would say that this, the PCV for this patient is 47%. Okay, so now I'm also going to do my total solids, or also known as total protein, with my microhematocrit tubes. So basically what I'm doing is I'm going to try to cut this tube and get this that's right here in the tube. So I'm going to go ahead. These plastic ones are really hard to get. Okay. So I'm going to set this one here, and I'm going to get the liquid out onto the refractometer by just blotting it like this. I like to get a lot on there because sometimes it can be difficult to read. Okay, so now I'm done with that. Go ahead and put my lid on. Now go ahead and hold the top. I'm going to look up into the light. I would say that this one is 7.6. So my total protein / total solid is 7.6 on this patient.